Hello.
Hello.
Dear Professor Hachinski, we are here in Vienna for the 12th World Congress for Neurorehabilitation by the WCNR. What is your first-hand opinion of the event so far, and have you participated in any previous editions?
I've never been to a World Congress, but I've been to others, like the European ones. Well, the first impression, the richness of the things that are presented. I mean, there's a lot of information and good information, and the quality of the speakers is quite amazing, well organized. Now, I think that if you had a theme, it would be multidisciplinary. However, I think that the next step is really integration, and I wondered whether it would be possible to take some of the different subjects in an area and then actually offer many qualifications, in other words, a certificate as some sort of evidence that the person has acquired the skill necessary for a particular area. And I would emphasize the teaching by using different cases so that when you see a patient with, say, Parkinson's disease, and they might be 2 or 3 typical presentations, that you can relate your patient to what the guidelines are for managing such a case. So I think the remarkable thing is that the connection with other specialties, particularly neurological specialties, but also technology, and of course the latest in basic science and the capability of brain plasticity and rehabilitation.
Right. And my next question would be, what do you believe is the overarching theme of this year's Congress?
Multidisciplinarity, I think. I think that's the overarching thing, because there's such a variety of things. I think the only shortcoming is there's so much on offer that sometimes you want to go to 2 different things at the same time, so you cannot. So in some ways, I think consolidation would be helpful, because I think the organization is superb. Clearly, the organizers have the capability of inviting top people, and I think I look forward to the meeting in Vancouver. It'll be even better.
All right. From your perspective, what is the role of hybrid multidisciplinary events in developing neurorehabilitation research and practice, and what other avenues do you believe are worth exploring?
Well, I think, well, first of all, I think hybrid is the future. There have been a few good things for the pandemic, and that is the tremendous increase in connectivity. You know, access to patients, access between different specialties, and also the integration of many efforts, and the ability to be looking after some patients some of the time at their homes. And so I think it's very important to establish the personal relationship. It's never the same to Zoom or to see someone on video as compared to seeing them in person. But once that rapport is established, I think it is helpful to actually visit them in their home and look at their environment and be able to have other members of that family participate in the rehabilitation, because I think the resources are limited, and I think we have to call upon not only the professionals, but also volunteers and caregivers to make sure that we provide the best we can with the resources that we have.
Right. Could you please tell us a bit about your recent project, the comprehensive, customized, cost-effective approach to the prevention of dementia?
Yeah. There's no comparison between the effectiveness of prevention and acute care and even rehabilitation. I began my career with acute stroke and became very proud how well we can treat stroke. But you can look at it another way. Every stroke is a prevention failure, and we can do much better. My theme is, this afternoon, can we do better in preventing dementia, stroke, and heart disease? They share the same risk factors. The main one is hypertension. Hypertension is highly prevalent. The chances of an individual developing high blood pressure is 80% in their lifetime. Only half the people who have high blood pressure know that they have it. And among those who know that they have it, only half have it controlled. So it's, on the one hand, a tremendous problem. On the other hand, an immense opportunity, because we know how to treat hypertension. The first 2 steps are exercise and diet, especially cutting out salt and sugar and bad fats. And then the next step is drugs, and there are many effective cheap drugs that are widely available across the world. So one of the things that I tell my patient, so when I see a patient, I'll ask whoever's coming with the patient, a spouse or usually a daughter. The daughters are better at looking after the parents than men. And I asked them two questions. I said, do you know the symptoms of stroke? Most people don't, actually. And everybody needs to know, even children, because if they see somebody, who has sudden loss of speech and they cannot move one side and they lost balance, they need to get an ambulance or let somebody know. So everybody needs to know. So if they don't know, I teach them. And next time they visit, I ask them. And then the second question I ask, do you know your blood pressure? If they know the blood pressure, then I usually arrange for the office to have it taken right there. And if it's high, I said, you better follow up on this. You need to treat this. So these are two very simple things that make a big difference, because you see, unless people know the science of what a stroke is, then they may end up having a stroke. Or for example, they might have the symptoms that disappear, but the risk doesn't disappear. So that's so simple and so important. And as you probably know, people who have a stroke doubles the chance of developing dementia. So one way of preventing some dementia is prevent stroke.
How can multidisciplinary approaches and international collaborative efforts help reduce the burden of stroke on patients?
The question is, how can the different disciplines collaborate? I think the answer is that they should identify what they have in common interests. For example, I'm Canadian, so I'll talk about the Canadian situation, but there are equivalent organizations in most countries of the world. In Canada, we have the Heart and Stroke Foundation, we have the Alzheimer's Society, and we have Hypertension Canada. And so they each is interested in prevention, but they don't do it together, you see. So for example, high blood pressure is a risk factor for stroke, for heart disease, and for dementia. So why not get together in campaigns to control blood pressure? So you're preventing all three. It's cheaper, you get more people involved. And the other thing that's happening is, of course, there's many more wearables. I mean, these are little things that people can wear. And so, for example, the sleep can be monitored now by having a little device. You can monitor the heart if you have atrial fibrillation, which is an irregularity that can lead to stroke and also to dementia. So to go back to your previous question, we have to involve everybody in brain health, and also sort of saying, not only do you have to do this because 20 years from now you could have dementia or stroke, you have to do it now because you'll feel better. If you exercise, if you eat well, if you sleep well, you'll feel better, you perform better, right? So.
And how can multidisciplinary approaches reduce the burden of stroke on the healthcare systems?
Well, I think that if there are fewer strokes and fewer dementias, it's easier for everybody. And those resources can be used in education. And the other thing is that now with the digital age and the knowledge-based economy, everybody needs to learn all the time. For example, with the pandemic, I don't like computers. However, I had to learn a lot. I learned how to Zoom, how to lecture, how to do these things. And so this will continue to change, and I have no choice, even at my age, 37. I'll have to continue learning. And certainly younger people, they will not have one profession. I've been a doctor all my life, but nowadays people have 1, 2, 3 professions because the demand changes. And so I see universal education for everybody all the time. And of course things have become easier. You can again combine in person, which is very important, with virtual. So I think hybrid is part of the future and is going to increase.
Right. And my last question would be, what are the most at-hand instruments to increase awareness of the impact of stroke and dementia?
Yeah. Well, the most important thing is to reach people in what I'm calling an actional community. In other words, we all see, we doctors are not very good at asking for the help of sociologists and demographers who study populations and how people organize themselves. Well, it turns out that if you want to do something and you may be very effective with it, the number is about 7, give or take 3. If it's larger than that, people don't feel that all in one little group, don't have that sense of commitment. On the other hand, people have networks. You know, you have friends, and that influence each other. For example, in the United States, they did a program whereby they found that if you're obese, your friends, you know, have a 50% chance of also being obese. And your friends' friends has a 20% chance of being obese. So, you know, it can spread. That's bad things. But on the other hand, if I quit smoking, then there's a 50% chance that my friend will stop smoking and a 20% chance that his friend will stop smoking. So I think we have a lot to learn how people get organized and how we can take advantage of some of these human characteristics. And then the other thing I would say is that I'm optimistic because it turns out that it doesn't take that many people to change a habit. For example, when I was growing up, everybody smoked, particularly women. I thought it was cool. Well, now you look at that, oh my God, the woman smokes. Oh, she stinks, right? You know, it's sort of a change in culture. So we have to change how we look at things. We want to be healthy, exercise, sleep well, and that becomes the norm. And they get a few people who can champion that. You know, we have examples in athletes, you know, the soccer players. What a terrific brain those people have to kicking in at a split second. And we tend to think of the brain as being studies, you know, professors, but everybody needs a brain. And so people who do sports, people who build things, people who drive race cars, you know, they all need brains, and they have wonderful brains. So I think this is the most precious thing. The brain are the 3 most precious pounds in the whole universe. And if we treated an expensive, how would we treat an expensive car? There was only one model, you can only buy one, and it has to last a lifetime. You treat it very well.
Definitely.
And we would treat our brain, we should treat it as well as a very expensive, exclusive car.
All right. Thank you very much, Professor.
You're
Thank
welcome.
you for being here.
My pleasure to be here, and thank you for asking me.